Well, Mom's Special Day is right around the corner, so ahead of Mother's Day and in honor of all the moms out there, this week's episode of In the Know is dedicated to maternal health and advice for new moms. So joining us today, we have Lisa Smith from OSF Healthcare. Welcome, Lisa.
Thank you for having me.
Of course. So as we mentioned, Mother's Day right around the corner. A lot of moms are celebrating for the first time. What are some of the challenges that new moms face?
I think the very overwhelming nature of finding out that you're going to be a new mom brings a lot of anxiety, and so learning what you need to do, finding out how you need to handle things, getting appointments scheduled with your doctor, figuring out who the pediatrician's going to be. There's just a lot of planning that you need to do, and finding your resources is a good thing.
Right, right. And what are some of the challenges new moms face once the baby is born?
Once the baby is born, figuring out how to navigate life with a human being that depends on you solely, I think is one of the biggest things. Feeding choice is always a big discussion, a big thing that we talk about at the hospital when you come to have the baby. Before you even deliver, it's good to think about those things. What feeding choices are you going to make with that newborn? And then how are you going to be best supported and find the resources that you need to make to have success with that? One of the biggest things that we recommend nowadays, best practice, is to room in with your newborn after birth. Avoid using a nursery at a hospital if you can. You're going to learn the feeding cues of that baby. And that's going to lead to a calmer baby, which is an anxiety relief for new moms.
Absolutely. And what are some of the things that moms can do to prioritize not just their health, but the baby's health during pregnancy and then also after the baby's born?
Yeah, during pregnancy, you're going to want to start thinking about how you're going to have health care for that baby. What are your child care resources going to be after you have the baby? And maybe if you're going to be returning to work, thinking about those issues. How long am I going to be off? How am I going to ensure that there's child care for my baby while I'm at work? How am I going to feed the baby while I'm at work? And making decisions if you're going to be a breastfeeding mom, when do I need to start pumping while I'm on maternity leave to build up a supply of milk so I'm ready for a daycare situation or for babysitting.
Very nice. Some good tips there. And also I wanted to talk about postpartum depression because I know it's very common among new moms. I think some studies show as many as 1 in 7 women, others show 1 in 10. What is your advice for new moms who may be dealing with that and maybe they're feeling guilty for feeling that way? Right.
Postpartum depression is something I think that we need to talk about more as a society. We need to support women through that. We need to know that we need to eliminate the stigma and shame associated with that, and we need to help them. And what we do in the healthcare industry is we've developed screening tools to identify postpartum depression. We screen at certain points after delivery. We even offer, when you're in with your midwife or your OBGYN for a prenatal visit, they're going to be checking in to make sure that your mental health is going well also. But then after delivery, we screen, we watch for signs, we offer support and resources, and we really want to encourage people to speak up. It's okay to say that you need help. It's okay to talk about how you're feeling and what is, seeking those resources. And there are lots of resources and lots of healthcare professionals that want to provide that help and support.
Well, that's good to know that help is out there. And like you said, we're getting rid of that stigma is so important. So where can new moms turn if they do need just more information or resources or just anything?
The first place that I would always recommend is your healthcare provider, your OBGYN, your midwife. Maybe you had a doula for your birth, and that is a person that is, very vested in making sure that you have an excellent experience delivering and in your postpartum phase. your nurses at the hospital. They're excellent resources as well. So speaking up and starting with your healthcare providers, there's lots of online resources. There's lots of online counseling resources. So I think just seeking that from a healthcare professional, or even just mentioning to your primary practice provider how you're feeling. Everybody's out there looking for that and wanting to be supportive of our new moms.
Absolutely. We love our new moms. We love all moms.
We do.
Well, thank you so much, Lisa, for coming in this afternoon.
Thanks for having me. I appreciate it.
Of course, anytime. And of course, if you or someone you know would like to join us here on In the Know, you can head to our website, 25newsnow.com, and click on the Features tab. Go ahead and select the In the Know, and then submit an interview request form, and we'll take a look at it, and we hope to have you here in just a little bit. And we'll be right back with another check of your forecast, so stick with us.